Hey Mason families, as we're back here this week giving you a quick update, before I jump into the details, I just want to share a story with you. This is a personal story. I was at a concert this week, and it was our fourth grade students, and they were wonderful. It was a delightful concert, and I'm listening to them, and it hit me. I was listening to them sing, "Don't Stop Believing," and then all of a sudden, I realized this is the group, when I was sitting right here at this table with my executive team, that it was the first cancellation of the COVID pandemic, was their second grade concert. And it's come full circle, and now they're up on stage, singing their hearts out, dancing with parents, taking pictures. It was one of those full circle moments that I just had to celebrate and share with you. It's important to pause and reflect on all that we've been through together, where we've been and where we're going next. I hope that you're having some of those moments as well, and just appreciating all the things we do have and as we move forward. So let me go through some updates this week in the district. You probably heard that the Ohio Department of Health and the governor's office sent us new guidance as schools. It's something that we're getting used to all the way through the last couple of years of the pandemic. Things change, and we have to adjust and adapt the best that we can here in our school district. So one of the things that changes, a major thing across the state of Ohio, is that they are no longer having schools contact trace. That is where we are in the pandemic, and so they're moving past and beyond that moment. And what they're asking schools to do is only contact trace when there is an elevated or a significant increase in cases in a certain area. They would call that a cluster or an outbreak. And so we'll work with our local health department to address that appropriately, just as we have throughout the entire pandemic. One of the things they also changed was they asked school districts to start posting their data on a weekly basis, weekly dashboards, and go to a weekly update. We talked a lot about that as a team, and we decided that at this point in time, we will continue to give updates on a daily basis with our live dashboard. We felt like that was the best place for us to be at this point in time, because we've come to get used to that as families, and we look to that to make decisions about our events in the afternoon and throughout the weekend. So I just want to let you know that we're going to continue to commit to that for now, and that transparency. If that changes, we would let you know. The other thing I wanted to share with you is there's some new information with our processes. You know, 2 weeks ago, when we moved to a temporary mask mandate, one of the things I shared with you is that we were really having a difficult time with staffing. We were really having a difficult time with even the processes and managing all of the information coming in at one time because of the surge. And what we have done throughout those 2 weeks is really committed to refining our process internally to align with the new guidance that just came out from ODH. So here's what this is going to look like moving forward. First of all, you're going to call in your child just like you have throughout any sickness or illness, and let us know that they're ill. And when you do that, you'll indicate if they do have a positive case of COVID-19. You'll do that through the Safe Arrival call-in system, just like you had before. When that happens, that will trigger an automated system to allow us to know that that's a COVID-19 call-in. And there will be an automated email sent to you. And in that email, it will give you some information that you need to know. Also gives you a link to a Google form. In that Google form, we're asking that you would update the information in there. It'll ask you some questions about when did you test positive, maybe when do you expect to be back based on the guidance, and so that we can collect that data, because that data continues to help us with our decision making, as it always has throughout the last 2 years. So we're asking you to fill that out, complete that. In the past, that was the nurse calling you and asking those questions, but we're really trying to move that off the nurse's plate. They have plenty to do on their day-to-day work. So we needed to move that beyond. And so please help us with that by completing that information appropriately. And then, so you'll get that email. And then the last thing I would say is, if you have questions about COVID processes, procedures here in Mason City Schools, we ask that you go to our website and check that information first. We have the information posted there. We also have a number for a COVID specialist here in the district, so you can call 513-770-2040. Or you can send an email to covid@masonohioschools.com to get your questions answered. We would ask that you would not call directly to the nurse, that you would actually use this resource so that we can allow our nurses to focus on the day-to-day work that they need to care for our kids. And then just another reminder, we've talked a lot about, remember, it's 5-day isolation. And that 5-day isolation used to be just for students that were having direct contact at school alone. They've actually expanded that. So if you're a direct contact in any setting at this point in time, in our community, at school, at home, you'll need to follow this guidance. So what that means is if you have symptoms that began or you test positive on a Monday, for example, we count that as day 0. And then you count 5 days beyond that, and that's when you can return to school on that 6th day. So you can come back. If you test positive on that Monday, you can come back the next Monday when you're fever-free and not ill any longer. The same thing goes, you can follow the chart here and kind of find that out. That's also available on our website as well if you need to reference that. So just remember, exposure, direct contact in any setting, we're asking that you would please follow this carefully, and when you come back, we're asking that you would continue to wear your mask for an additional 5 days when you're back in our setting. All right, and then one other update here is just a reminder, we did have a 2-week temporary mandate for mask. That was I shared that with you a couple weeks ago. This is the final day of that mandate for mask. We're going to be moving forward into a highly recommended mask status, and so I'm highly recommending that you are wearing a mask in settings where there are lots of people, and that would be school. So we're highly recommending that. We've learned a lot about what that looks like. There's different kinds of masks that you can use, and you know that. We have the high-level 3-ply mask, surgical style mask. We have those in our buildings. I know that you have access to those as well. We've also provided the N95 mask for all of our teachers, and so that's another mitigation strategy. And for anyone that is concerned personally about the quality of what other people's masks are or how they're wearing their mask, there's so much good research out there about one-way mask wearing at this point in time. And so the N95 mask is an option, especially with vaccination, to keep people as safe as possible. So I do encourage you to even read more about that. As we look at some of the information, reminder, and our medical partners have told us, our doctors in the region have told us across the state, please continue to consider getting vaccinated if that's not something you've done. And here's why. The hospitals, they're overwhelmed, but they're overwhelmed with people who have not been vaccinated. So 94% of the people that are in the hospital that are having any kind of severe symptoms from COVID are not vaccinated this time. And that message has been strong and clear to us from our partners. So they want us to continue to share that with you and to encourage you with that so that you can be as safe as possible and keep those around you as safe as possible. So one last reminder, personal mitigation strategies are really important. We know that, we've known that even before the pandemic. You can wear your mask, I've highly recommended that, and we'll be modeling that for you throughout the next week to remind people that that is a mitigation strategy. There's also other things, washing your hands, hand sanitizer, being thoughtful about coughing and what that looks like into your elbow, all the things that we've learned before. And most of all, if you're sick, stay home. Whether you have COVID or something else, if you're sick, stay home, because we don't want you to spread that to other people. We want people to be healthy. Our staffing levels have been amazing this week. We're so fortunate. We had so many people that were either sick or had someone sick there the second week when we returned that we had to shut down. And we thank you for your patience when we did that. Well, it's gotten so much better. We're at such a better place and the data is going in the right direction. But to continue that, please practice these personal mitigation strategies and stay home if you're sick. Hey, and last but not least, I have to say this. We have so many exciting things going on here in Comet Country, and so I want to say go Comets. But we also have these wonderful people here celebrating with our very own 1988 Bengals player who is one of our staff members here. And Mr. Fulcher is one of the just amazing people that joins our staff each and every day to care for our kids. And he was here celebrating this morning. And since we have hired another Bengals player here, you know, we have a couple from the past, they've been winning. Now, I don't know if that's a direct connection, but we're going to continue to hope and cheer them on as we move forward just 4 quarters towards the Super Bowl. Hey, everyone, have a great weekend. Enjoy your family. Enjoy your time. Go Comets. Go Bengals.